Welcome viewers. Constipation is more than just a bathroom problem, it's a common digestive issue that affects people of all ages. Whether it's occasional or chronic, it can severely impact your comfort, mood, and even your health. In this video, we'll uncover what causes constipation, how to identify it, and what you can do to manage or prevent it. Let's begin your journey toward better gut health. What is constipation? Constipation means having fewer than 3 bowel movements in a week. But it's not just about frequency, it's also about stool consistency and the effort needed to pass it. You might have dry, hard stools or feel like you're not fully empty after going. For some people, even going daily feels difficult, and that's still constipation. Understanding normal bowel patterns. Bowel habits vary widely. Some people go 3 times a day, others only a few times a week. Both can be normal. What matters is your usual routine. If that suddenly changes and lasts for more than a few days, it could be constipation. Common symptoms of constipation. You may feel bloated, heavy, or uncomfortable in your abdomen. Passing stool may feel like a struggle, requiring straining. Stools may be small, dry, and hard, and even after going, you might not feel relieved. Gas, abdominal cramps, and nausea can also accompany constipation. Types of constipation. Constipation can be classified into different types. Primary or functional constipation is due to slow movement of stool through the colon. Secondary constipation happens due to medical issues or medications. It can also be acute, short-term, or chronic if it lasts more than 3 months. Lifestyle factors that cause constipation. Low fiber intake is a major culprit. Without enough roughage, the stool doesn't bulk up properly. Dehydration makes stools harder and harder to pass. Lack of physical activity slows digestion. Even delaying the urge to go to the bathroom regularly can lead to long-term issues. Medical conditions linked to constipation. Constipation isn't always just about lifestyle. Health conditions like underactive thyroid, hyperthyroidism, diabetes, or irritable bowel syndrome can slow digestion. Neurological disorders like Parkinson's disease also affect gut motility. Sometimes, physical blockages in the intestines or rectum are to blame. Medications that can cause constipation. Certain medicines can slow down bowel movements. Opioid painkillers, antidepressants, and iron or calcium supplements are the most common offenders. Antacids containing aluminum or calcium and blood pressure medications can also contribute. If your constipation started after beginning a new medication, speak with your doctor. Who's at risk? Older adults are more likely to experience constipation due to reduced mobility and slower metabolism. Pregnancy is another time when hormonal changes can slow digestion. A sedentary lifestyle and poor diet increase risk significantly. Anyone who ignores the urge to go for long periods is also at higher risk. Warning signs that need medical attention. While occasional constipation isn't alarming, some signs should never be ignored. Blood in the stool, sudden weight loss, or severe abdominal pain are red flags. A sudden change in bowel habits, especially in older adults, needs evaluation. If you're also experiencing nausea, vomiting, or bloating, consult a doctor promptly. How constipation is diagnosed. Doctors usually begin with a detailed history. They'll ask about how often you go, the stool type, and dietary habits. They'll also ask about fluid intake, medications, stress, and activity level. These insights help narrow down the possible causes. Physical examination. Next comes the physical exam. Doctors may gently press your abdomen to check for bloating, tenderness, or hard masses. A rectal exam helps assess muscle tone and detect blockages or impacted stool. This exam is quick and can give important clues. Investigations and tests. If your symptoms are persistent or severe, tests may be ordered. Blood tests can reveal thyroid issues or anemia. Imaging like an abdominal X-ray or CT scan can show stool buildup or blockages. In some cases, a colonoscopy may be needed to rule out tumors or inflammation. What can happen if constipation is ignored? Long-term constipation can lead to complications. You might develop hemorrhoids from excessive straining or anal fissures due to hard stools. In severe cases, stool can build up so much that it causes fecal impaction, which may require manual removal. In rare cases, rectal prolapse can occur, especially in older adults. Goals of treatment. The main goal of treatment is to relieve current symptoms and prevent them from coming back. It's not just about quick fixes. It's about improving long-term habits, correcting diet, and avoiding complications. Sometimes, medication is needed to support these changes. Dietary modifications that help. Fiber is your friend. Whole grains, fresh fruits, vegetables, legumes, and seeds add bulk and soften stool. Avoid refined or junk food, which slows digestion. Eat meals on time to train your body's natural rhythm. Hydration matters. Water is crucial. It keeps stools soft and helps them move smoothly through your intestines. Aim for 6 to 8 glasses daily, or more in hot weather. Avoid too many sugary, fizzy, or caffeinated drinks. Warm fluids in the morning, like herbal tea or warm lemon water, can stimulate movement. Why exercise helps? Physical activity boosts your digestion by increasing muscle contractions in your intestines. Walking, cycling, yoga, even 20 to 30 minutes a day can make a difference. Exercise also helps reduce stress, which can trigger constipation. The more you move, the better your bowels move. Healthy toilet habits. Try to go to the toilet at the same time each day, especially after meals. Don't rush, give your body enough time. Never ignore the urge to go, holding it in makes things worse. Creating a relaxed, distraction-free environment can make bowel movements easier. Over-the-counter. There are many OTC options to consider. Bulk-forming agents like psyllium help add volume. Osmotic laxatives draw water into the bowel. Stool softeners can make passing easier, but these should not be used regularly without advice. Prescription medications. If lifestyle changes and basic remedies don't help, your doctor may prescribe medicines. These include prokinetics, which improve gut movement, or secretagogues that help hydrate stools. In serious cases, enemas or suppositories may be required. Always use these under medical guidance. Tried and tested home remedies. Simple remedies can make a big difference. Start your day with warm lemon water. Drink prune juice or eat dried prunes. They're rich in fiber and natural laxatives. Castor oil can help, but only for short-term use under a doctor's advice. Natural supplements for support. Flax seeds are rich in both fiber and healthy fats. They work well in smoothies or yogurt. Aloe vera juice may soothe the digestive tract. Triphala, a herbal combination from Ayurveda, has been used for centuries. Psyllium husk is safe, effective, and widely recommended. Constipation in children. It's very common in toddlers and school-aged children. Causes include low-fiber diets, fear of using unfamiliar toilets, or even toilet training pressure. Encourage fruits, water, and regular toilet breaks. Avoid punishment and use positive reinforcement. Pregnancy and constipation. During pregnancy, hormonal changes slow down digestion. The growing uterus can also compress the bowels. Iron supplements often make things worse. Mild activity, extra water, and fiber-rich foods are usually safe and helpful. Constipation in the elderly. Aging naturally slows down the digestive system. Many older adults also take multiple medications that can worsen constipation. Reduced mobility and low fluid intake are common issues. Gentle, customized treatment is often needed in this group. When it becomes chronic. If constipation continues for over 3 months, it's considered chronic. This type usually doesn't respond to simple lifestyle changes. A deeper investigation is needed to rule out serious causes. Don't delay, see a gastroenterologist if symptoms persist. Watch out for these red flags. Signs like blood in the stool, persistent fatigue, or rapid weight loss should never be ignored. Also, if you suddenly become constipated after age 50, get checked. Loss of appetite, vomiting, and constant abdominal discomfort are serious. These could signal an underlying disease. Surgical options, rare cases. In rare, severe cases where the colon isn't functioning properly, surgery might be necessary. This could include removing a part of the colon or correcting structural issues. These are last resort measures when all conservative treatments fail. How to prevent constipation? Prevention is easier than treatment. Eat a balanced, fiber-rich diet, stay hydrated, and move regularly. Train your body with a fixed toilet schedule. Avoid frequent use of laxatives and keep your gut healthy with good habits. Myths and misconceptions. Let's clear up some confusion. You don't have to go every single day. What matters is your normal. Not all laxatives are harmful if used correctly. Fiber helps, but it's not a magic fix. And no, constipation is not always harmless. The guts-mind connection. Did you know stress can slow down your bowels? Your brain and gut communicate closely. This is called the gut-brain axis. Anxiety, depression, or lack of sleep can make constipation worse. Mindfulness, therapy, and stress management all help your gut function better. Constipation in ICU or bedridden patients. In patients who can't move or are on heavy medications, constipation is very common. Lack of mobility slows the intestines. Regular monitoring, softeners, and sometimes enemas are used. Proper care is essential to avoid dangerous complications. Final doctor's advice. Don't ignore your symptoms or self-medicate long-term. If you need laxatives every week, something is wrong. Use food, water, and exercise as your main tools. And if things don't improve, seek professional help. Conclusion. Constipation may be common, but it doesn't have to be a permanent part of your life. With the right approach, you can prevent and treat it effectively. Listen to your body, take care of your gut, and stay proactive. Thank you for watching, and take the first step toward better bowel health today. Please like, share, and subscribe for more health-related videos.